let me tell you, I get so confused on retirement, on disability retirement sometimes. I have someone call me up and they're like, hey, I'm on the, TDRL and blah, 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 blah. And I'm like, whoa, hold on a minute. What in the world is that? And over time I learned you got the temporary retirement list and the permanent retirement list. So what's the difference between these two?
So when you're found unfit through the IDAS process, if the PEB determines that your condition is not stable or unstable, they will place you on the temporary disability retirement list, TDRL. And what that means is that you're going to have your unfitting condition reevaluated approximately a year to 18 months to 2 years after you are retired. And then at that point, they most likely will make it a permanent decision in your case. So on your initial finding of unfit, they can say temporary disability retirement list or permanent disability retirement list.
Okay. Now, if you're put on the permanent list, can they pull you off and put you on the temporary list?
Nope, you're done.
Okay.
So once your retirement orders hit, you are done and it is permanent.
Okay. Now, if you're on the temporary list, does it automatically go to the permanent list after a period of time?
Not automatically. So there will be a re-examination done by the Army to determine whether or not your condition is stable. And if it is stable, then at what level is that condition? Has it gotten better? So then your rating drops, or has it gotten worse? So your rating increases. And remember that if you're found unfit through the PEB, if your unfitting condition or conditions is rated at 30% or more, you're medically retired. But if your unfitting condition is 20 or less, then you're separated with severance pay. So you could be temporarily retired, but then upon reevaluation, they say, now you're going to be separated with severance pay.
Well, that seems like it would be a huge financial loss to the soldier.
It is.
All right. Is there grounds to appeal that?
There definitely is.
All right. And what is that?
So during the TDRL process, you do have the right to have an attorney through that process. And I 100% recommend anybody going through the TDRL process to talk to an attorney while going through it. Because again, if you get that result where you drop from a retirement to a separation, you can request a formal PEB hearing. And at that, you can address the rating that you were assigned for your unfitting condition or conditions. And you can address that to the board. A little bit different than the initial PEB process, because through the initial PEB process, the VA assigns that percentage. When you go through the TDRL re-examination process, the Army, the PEB, the Physical Evaluation Board, uses the VA rating code, but they assign that percentage. So if we need to appeal and say that the PEB got that rating incorrect, we can do that. And
all right.
Obviously, evidence helps that.
Yeah, in evidence are medical records and these nexus letters and other things of that.
Exactly. And when I talk to a soldier who is going through the PEB the first time, and their result is that they're going to be on the TDRL, the Temporary Disability Retirement List, I will tell them up front, you're going to be on this. This is going to be the reevaluation. This is what you need to do. Continue with treatment. Okay, so a lot of times people get out of the Army and they're like, I don't want to go to, see my behavioral health doctor for my PTSD, and they just stop. Well, if you don't have those medical records, that's when your rating drops. So we try to stop any issues at the initial PEB, but we do have the opportunity to appeal during the TDRL process as well.
All right, so if you've gone through the initial PEB, found, and you've got a rating, and you're put on the on the temporary list, right? Seems like you should see a lawyer immediately to lay the groundwork for what's going to ultimately be another evaluation.
100%.
Okay, and that lawyer, someone who knows what they're talking about, will be able to advise you as to, hey, here are the steps that you need to take to be walking down the path towards permanent retirement versus separation.
Correct. 100%. And we can also address with you what type of evidence will be considered in that rating and kind of catch any issues that might arise, or in some circumstances, it's a little bit difficult, but you can plan ahead on what you need to do to address it so you get the outcome that you want.
All right. Well, is there any circumstance where someone is put on the temporary list that they go back on active duty?
Actually, yes, that can happen, but they cannot force you to do it. So if you are on TDRL, and I don't think I've said it before, temporary disability retirement list is maxed out at 3 years. So that's the longest you can be on it. And if you have not been reevaluated by the 3rd year, your benefits will just stop. So it's not like the Army says, oops, we haven't done the reevaluation. No, your TRICARE health insurance stops, your retirement pay stops. So you want to make sure you are reevaluated before you hit that 3-year mark. In that time period, when you're reevaluated, if the board comes back and says, hey, you had this autoimmune condition and it's gone away and you're good to go back to active duty. Now it's the soldier's decision of whether or not he wants to be put back on active duty or not, or whether or not they just want to be separated at that point.
All right, so they make the decision to either separate or go back on active duty. If they go back on active duty, do they just reassume the rank they were at? Well, I mean, how does that work?
Yes, that's exactly what they do. They reassume the rank that they were at when they got off. Their time in as retirees do not count. So it kind of throws off their year group for promotion purposes and things like that. But yep, they go back on. And every once in a great while, this does not happen often, but every once in a great while, someone does want to go back on active duty. Let's say they had 18 years in. They just want to do 2 more years so they get that full retirement with the concurrent receipt of both the VA disability pay and the Army retirement. So there might be a reason why they want to do it for a short time period.
All right. Now, if you're set for a reevaluation and you're going and you're working with us, I guess what we would want to do is make sure we got your diagnosis down, we've got the functional limitations on your ability to perform your duties, and we want to anchor that to what the VA has said and to what the medical records say, right?
Exactly.
And what else do we want to do?
We want to make sure that we address whether or not the PEB correctly use the VA rating code and the VA rules when assigning that new rating. Because this is something that the PEB does not do often. And so we want to make sure that they address that correctly. We can also look to see if there are any additional conditions that are secondary to the original condition. So if somebody had a really bad back and that's how they got out and they were on the TDRL for their bad back and their bad ankle and that got them to 30%, well, now they also have radiculopathy, numbness, tingling, pain that shoots down their leg. Well, now we can argue that they should be found unfit for the back, the ankle, and the secondary condition of the bilateral radiculopathy.
Well, it seems to me that what would be important if you're on the temporary list is you need to maintain your medication therapy. You need to maintain your medical treatment, and you should probably keep a diary of some sort of your pain and how this is interfering with your life.
Yes, exactly. You want to keep that record, and you have to be the honest broker of what you can do during that reevaluation period. And then once it's permanent, and you're not going to have to worry about it on the Army side ever again.
So if you're on the TDRL or you're facing temporary retirement or you've got a reevaluation, you need to see the lawyers at the law office of Will M. Helixon. We are your warrior advocates. You defend the nation, we defend you.